this is Dr. Abdequaem Chimthanawala. Today let us discuss a case which I had cured. A case of headache, congestion in the head the patient had, and as the patient unfolded the symptoms which he was suffering from, a very beautiful picture of that drug came, and it acted wonderfully in that case. So as we unfold symptom by symptom, just let the patient talk and you can arrive at the remedy which you never thought of. So don't disturb the patient when he's trying to narrate the symptom. Just keep on asking him symptoms, keep on probing the case unless you get that picture of the remedy. Don't be prejudiced in prescribing. This was a case of congestion and hyperemia in the head. He had a severe headache, congestion in the head with nausea and vomiting. The patient came and told me that, sir, I have headache. It is so painful, ऐसा तो पूरा भरा हुआ है, congestion लगता है, and I have nausea and I have vomiting. Then I said, when does the pain increase? He told me, whenever I have diarrhea or whenever I have dysentery, I take medicines, it is better, diarrhea is better, and the congestion starts, and the pain in the end, the hyperemia in the head starts, the congestive pain starts. Third, I said, how is the pain? He said, it is pulsating and throbbing of the arteries. There is a pulsating, ऐसा तो पूरे सर में, in the whole head there is pulsation and the whole arteries of the head are throbbing. So if you have this symptom that as if the arteries in the head are throbbing, you must remember one drug, that is causticum, a very important drug where there is pulsation and throbbing in the arteries in the head. I said, can you tell something more? He said, sir, whenever I have this headache, it is more congestion I feel in the occiput, here in the occiput. So this was the patient, and it was appearing very in the face also. There was a lot of anger I saw. So I immediately asked, okay, tell me something about your nature. And he told me, sir, I don't like to answer anybody. Whenever somebody tells me, I don't like to answer. I said, why? I said, like this only. I am very angry person. I don't like to answer. And if you have this symptom that the patient refuses to answer or refuses to answer, you must remember 2-3 drugs which I have seen in practice, that is phosphorus, hyoscyamus and sulfur. These drugs have aversion to answer with the drug which I am telling you also. I said something more about what, sir, one thing I'll tell you, I don't like to take lot of medicines. I go to some practitioner, he gives me 1, 2, 3, 4, 5 drugs, one for pain, one for acidity, one as a vitamin, one for my calming the head. I don't like this. I don't like to take medicines also. And I hardly take medicine. I take for one day and then I don't take. I don't like to take medicines. Now, whenever the patient is tell you that his mood is not good, in fact his mood is repulsive and does not like to take medicine, you must remember few drugs, and that is lacasis, califos and stramonia. These drugs also have the same mood, repulsive mood, does not like to take the medicine. As I probed the case further, he said, sir, also I have weakness from sunstroke. Whenever I have a sunstroke, I feel very weak, I want to sleep. Now, weakness from sunstroke, one drug only is there that you must remember, and that is glonine. Glonine has a very important symptom, weakness from sunstroke. So this was the symptom which the patient was trying to tell me. I said, something more you can add, and he again said, sir, I don't want to answer, this is what I am suffering from. I said, because of headache, sometimes there is pain in the eyes, or you can't see, there is blurred vision, there are stars in front of the eyes. I said, sir, yes, this symptom I have, that is colors before the eyes, green circle around the light. Whenever I see light, I see a green circle around the light. This symptom You have asked right, so I am telling you. So this was the case in front of me. Then I asked the wife which was sitting beside her, anything which I like to add, or anything which you feel that is very funny or very unique, and you are very unhappy and you are irritated because of that symptom, in that thing in your husband. He said, sir, ek baat bolu kya? He looked at her husband and told, इनको सर शॉपिंग ले जाओ. He feels कि मुझे क्लोथ्स फिट ही नहीं होते. कभी पैंट टाइट होती है, कभी कमर टाइट होती है, कभी पैंट की साइज छोटी रहती है, कभी लगता है बहुत चिपक रही है स्किन को, कभी लगता है वो बराबर फिट नहीं हो रही है. इनको 10 बहाने रहते हैं, इनको क्लोथ्स फिट ही नहीं होते. कभी इनके साथ शॉपिंग जाना बोलते तो हेडेक रहता है. कभी शर्ट पहन लेते हैं, कभी बोलते स्लीव्स बहुत टाइट है, कभी बोलते स्लीव्स बहुत लंबी है. Sometimes you said the shirt is very tight, the sleeves are very tight, I want it loose. Sometimes if I buy loose, then he tells it is very loose, buy me something tight. It is very difficult. So I looked at the patient and said, is she telling right? No sir, she does not know. I know the clothes she brings, it does not fit me. If I go to the best branded shop also, the clothes does not seem to fit me. And again he was angry, and I could see the anger on her face. So I said, okay. And now we have this symptom in that case. And what is that? Have you guessed the remedy? Well, I did not, because I had to again sit down and write the symptoms and then see what remedy comes in our mind. Let us start with the first symptom, that is congestion, hyperemia with nausea and vomiting. Now he told about the diarrhea, dysentery. Of course you must have guessed it, that congestion or hyperemia in the head because of suppressed discharges. Now because of suppressed discharges, if the patients get headache, you must remember, my friends, one drug, and that is simesifuga. In simesifuga, it is hyperemia in the head because of suppressed diarrhea. Second symptom. Third symptom what he was telling is more he has on the occipit. The location was occipit. And type of pain, pulsating, throbbing in the arteries of the head. Fourth symptom. Fifth, he has mentally very angry, so answers refuses to. He refuses to answer. Mood repulsive, does not want to take medicines, and he refuses to take the medicines. And weakness from sunstroke. This was a case in front of me, and of course the symptoms of eyes when he told about headache is whenever he sees colors green around the light. If you repetize these symptoms, a very important drug that comes to our mind, and that is, of course, with occipital headache and congestion in the head, with throbbing of the arteries, he sometimes feel that his blood, he sometimes saw that his blood pressure used to rise. So it will cover both the symptoms, the pressure symptoms and the hyperemia, the congestion symptoms in the head, if your remedy is right. And the remedy which came after repetition was Veratrum Viride. Yes, Veratrum, Veratrum Viridi, and Veratrum Viride 1 dose. What a beautiful result. The patient came and told me, sir, I feel as if पूरा जो ऐसी पानी का प्रभाव, खून का प्रभाव जो ऊपर चढ़ गया था, पूरा शांत हो गया है. He feels as if when the blood was rising in the head like a tide, it has come down and it has now stationary and is stagnant. I feel calm and relaxed, and my pressure also has come down. What a beautiful description he gave about this. See, this is how the remedy works. A calming effect in the brain, and he was much better with Viride 1 dose. And one symptom which the wife was telling and the patient was telling, and the wife was laughing because of that, That symptom also is present in Veratrum Viride if you repertorize the language of the patient in the form of repertory. And what is that? He had a delusion that clothes does not fit him. Delusion as if clothes does not fit him. And when I saw in the repertory, in the whole repertory, there is only one drug, and that is Veratrum Viride. Delusion as if clothes does not fit him properly. This was the case which I learned Veratrum Viride in detail. Few symptoms which I found interesting in Veratrum Viride, which I would like to share with you. The first symptom is swelling of the knee, which is very hot. Swelling of the knee, which is very hot, and you must compare this symptom with the drugs I have seen, that is belladonna, calcareous carb, China, ferrum phos, iodum, and pulsatilla, which have the same symptom, swelling of the knees, which is hot. Now, one symptom I would like to tell about Veratrum Viride. The patient desires to remain in the bed, refuses to rise, refuses to wear the clothing for no reason. हिंदी में बोला जाए तो पेशेंट को लगता है मैं बेड पे पड़े रहूं, मेरे को उठना नहीं है, मेरे को कपड़े पहनना नहीं है, फॉर नो रीजन, मुझे कोई रीजन नहीं है. दिस tries to tell you about the mood of the patient, the mental symptom, the anger. You know, we had seen refuses to talk, does not like to give answer, mood repulsive. So it's like that. Beautifully written in a Mater Medica. Patient wants to desire to sleep in the bed, does not want to wake up, does not want to dress up also. One drug which is written in comparison with this symptom, and that is Hyoscyamus. Hyoscyamus also has this symptom. One more symptom which I would like to add with Veratrum Viride is dreams. A Veratrum Viride patient has dreams of water. So two states we have seen. One state of, I've given example of a patient of congestive headache, hyperemia on the head, symptom which we repertorized and got the remedy, and rare symptom which you must remember of Veratrum Viride, that is dreams of water, mood repulsive, answers refuses to, swelling of the knee which is hot, and fifth, that is desires to lie in bed, desires to do nothing, does not want to wake up, does not want to wear his clothes also, similar to Hyoscyamus. So this is in short about Veratrum Viride. If you get a case of Veratrum Viride and if you get the results, please do share, because that gives a rare remedy to chance to prescribe for our fellow doctors. If you like this video, please do share and subscribe. Thank you.